Hello, my name is Dr. Ominda, and in this lecture, I'm going to discuss the jejunum, ileum, and the colon. So we'll start with the small intestine. So the jejunum begins at the duodenojejunal flexure. It's a continuation from the duodenum. So from the duodenojejunal flexure, and it is actually the beginning of the intraperitoneal course of the gastrointestinal tract. Remember, from the duodenum you get to the jejunum before the ileum. So it's from the flexure where the GIT enters intraperitoneally. So it mostly lies in the left upper quadrant, in the infracolic below the transverse colon compartment. The ileum lies mostly in the right lower quadrant. Majority of it is in the right lower quadrant and ends at the ileocecal junction, where now the GIT continues as the cecum. The terminal ileum lies in the pelvis, yeah, and after that it now ascends and ends in the medial aspect of the cecum. The jejunum and the ileum together are 6 to 7 meters long, and really there's no clear line that demarcates between jejunum and ileum. So this is the duodenum, C-shaped. From there, the red or pink is the jejunum, then the rest is the ileum. At the ileocecal junction is there before you get to the cecum here and the appendix. You can appreciate this is the duodenum, jejunum, then ileum. So blue is showing you the small intestines. So what are the differences between the jejunum and the ileum? The jejunum is the middle part of the small intestine. So it's between duodenum and ileum. The ileum is actually the final part of the small intestine. There's a suspensory muscle that indicates the beginning of the jejunum. However, the ileum cannot be demarcated from the jejunum, so there's no exact beginning of the ileum. The jejunum is wider, slightly wider than the ileum. The ileum has less than 2 centimeters in width. The jejunum is shorter. The ileum is long. The jejunum has folds which are thicker, 2 to 3 millimeters mucosal folds, while the ileum have less thick mucosal folds. So, furthermore, the folds in the jejunum are actually more or many compared to the ileum, and the jejunum absorbs fully digested carbohydrates and proteins, while ileum digests non-absorbed particles from the jejunum. So there is less lymphoid tissue, mucosa-associated lymphoid tissue in the jejunum. But remember, histologically, the ileum has the Peyer's patches. So other differences from the blood supply, you find that the jejunum has 1 or 2 rows of the arterial arcades, so from the primary vessel to secondary, then to tertiary. But in the ileum, the branching is more. So primary vessels give secondary, tertiary, quaternary, so there's more branching, more arterial arcades. Then the peritoneal windows in between, where the mesentery is, the peritoneal window is transparent in the jejunum, but in the ileum, it's sort of opaque because of lots of fat. Then the ileum has a thin wall, the jejunum has a thicker wall, and this shows you the thicker wall in the jejunum and the circular folds. This shows you the Peyer's patches in the ileum. So we've said the jejunum is in the upper part, ileum is in the lower part of the peritoneal cavity. The jejunum is wider, thicker, and redder, but the ileum is narrower and looks pale with a thin wall. Then jejunum is attached on the posterior abdominal wall to the left of the aorta, while the ileum is below and to the right of the aorta. Then the branching of the arterial arcades is more on the ileum than the jejunum. The translucent windows with less fat in the jejunum, but more fat in the ileum. Yeah, so interiorly there's plica circularis in both, but these plica are smaller and few in the ileum. Yeah, the villi are longer and more in the jejunum, and there's Peyer's patches in the ileum and absent in the jejunum. So this is just the same table showing you the differences between ileum and jejunum. So I try to put as many. You need to go through them and find out what are the differences. So the more you go through these different slides, the more you learn. So what is a mesentery? Mesentery is a fan-shaped fold of peritoneum. It's fan-shaped, and it attaches the jejunum and the ileum to the posterior abdominal wall. So the root of the mesentery is the origin of the mesentery. Yeah. So it's usually directed obliquely and inferiorly towards the right. Obliquely and inferiorly towards the right. This root of mesentery is 15 centimeters long. And what are the extents of the root of the mesentery? It's from the duodenojejunal junction on the left side of L2 to the ileocolic junction and the right sacroiliac joint. From the duodenojejunal junction on the left of L2 to the ileocolic junction at the right of the sacroiliac joint. So the mesentery, the breadth of the mesentery from its root to the intestinal border is actually 20 centimeters. So which structures are crossed by the root of the mesentery in order? So you have the ascending and horizontal parts of the duodenum, abdominal aorta, inferior vena cava, the right ureter, right psoas major, and right gonadal vessels. And between the two layers of the mesentery, you have superior mesenteric vessels, lymph nodes, fat, and autonomic nerves. So this just shows you, this is the mesentery, this is the root of the mesentery. You can see blood vessels and fat on the mesentery, and these are the structures crossed by the root of, this is the root of the mesentery. So you can appreciate that it's crossing the third part of the duodenum, the abdominal aorta, inferior vena cava, right gonadal vessels, right ureter, right psoas. Again, from the duodenojejunal junction to the right sacroiliac joint, crossing abdominal aorta, inferior vena cava, and the sympathetic chain. It's crossing the right ureter and the gonadal vessels as well as psoas muscle. So those are the structures crossed by the root of the mesentery. What's the blood supply to the jejunum and ileum? They are supplied by superior mesenteric artery. So they're supplied by superior mesenteric artery, and it's from the abdominal aorta at the level of first lumbar vertebra. And this is located 1 centimeter inferior to the origin of celiac trunk. This superior mesenteric artery runs between the layers of the mesentery and usually gives many branches to the jejunum and ileum. These arteries, they unite to form loops and arcs, which are called arterial arcades, and they give rise to straight arteries, which are the vasa recta. So arteries form arcades, which are loops and arcs, by uniting, and then you have from the arcades, you have straight arteries, which you call vasa recta, that go to the organs. And venous drainage is by superior mesenteric vein, which usually lies anterior and to the right of superior mesenteric artery in the root of the mesentery, so it's to the right, and it ends posterior to the neck of the pancreas. What is the termination of superior mesenteric vein? It unites with splenic vein at the posterior neck of the pancreas to form portal vein. So portal vein is formed by the union of splenic vein and superior mesenteric vein at posterior to the neck of the pancreas. So this just shows you superior mesenteric artery from abdominal aorta. It's giving branches to the jejunum and ileum. They join to form loops and arcades. From the loops and arcades, you have straight arteries, which are the vasa. And the blood supply of the small intestine is by the superior mesenteric vein. And so you'll still have the veins joining. These are jejunal and ileal veins. They join to the they join to the superior mesenteric vein, and we said superior mesenteric vein and splenic vein behind the neck of the pancreas, they form portal vein that goes to the liver through the porta hepatis. So this just shows the blood supply again of the ileum and the jejunum. So you can see jejunal branches from superior mesenteric arteries. So superior mesenteric artery actually gives intestinal branches that form arterial arcades and loops. And from there, you have the vasa recta, the straight arteries that will go to the bowel. Now, bowel usually has watershed areas. And how do you know the watershed areas? These straight arteries actually split. One will go to each side. Okay, so this antimesenteric border, remember the mesentery is here. These vessels are on the mesentery. So this antimesenteric border of the bowel is the watershed area, because these vessels, the vasa recta, are splitting into two to go on both sides of the intestine. So this antimesenteric border is the one that is getting the least nutrient, the least oxygen. So it's the watershed area of the bowel. What is the lymphatic drainage of the jejunum and ileum? So it has they have specialized lymphatic vessels within the villi of the intestines. Yeah. So the villi absorb fat, and these vessels that absorb fat, they are called the lacteals. So lacteals are specialized lymphatic vessels in the villi that absorb fat. So lacteal lymphatics in this lacteal is actually sort of milky. Okay, like chyme. So from these lacteals, lymphatic plexus in the intestinal walls take up the lymph, and then from there they go to the lymphatic vessels within the mesentery and to lymph nodes. So which lymph nodes pick all these lymphatics from the intestines? We have juxtaintestinal lymph nodes. Juxta means next. So these are lymph nodes that are close to the intestinal walls. Then we have mesenteric lymph nodes. These are scattered among the arterial arcades in the mesentery. Then we have superior central nodes at the proximal part of the superior mesenteric artery. So mesenteric lymph nodes are they eventually drain into superior mesenteric lymph nodes. So these mesenteric lymph nodes eventually drain onto superior mesenteric lymph nodes. The lymphatic vessels of the terminal ileum, they follow the ileal branch of ileocholic artery, so they can also drain into the ileocholic lymph nodes. So these are the lymph nodes that drain the small bowel. So from the lacteals to intestinal wall lymphatics, then to the mesentery, and from the mesentery to the different groups of lymph nodes, including juxtaintestinal, mesenteric, superior central, and ileocholic lymph nodes. So this image just shows the different types of lymph nodes. So you can appreciate superior mesenteric lymph nodes here, the superior central lymph nodes, the mesenteric lymph nodes around the arterial arcade, so it's within the mesentery, the ileocholic lymph nodes here draining the terminal ileum. You can appreciate the juxtaintestinal. Remember we said from the villi, which are on the mucosa, the internal lining of the intestine, then to juxtaintestinal lymph nodes before you get to mesenteric, superior central to the superior mesenteric lymph nodes, or the terminal ileum can get to from the lacteals to juxtaintestinal before you get to ileocholic lymph nodes. So what is the innervation of the jejunum and the ileum? Now, remember the superior mesenteric artery has perivascular nerve plexus. You have nerves around it. And these nerves, so the superior mesenteric artery actually helps to carry the nerves to the small bowel because they hike on the artery. What is the sensory innervation of jejunum and ileum? You have to remember that these two parts of the bowel are insensitive to pain. Okay, they're insensitive to pain, but they are very sensitive to distension. And this distension is usually perceived as what we call colic. Colic is a spasmodic type of abdominal pain. Yeah, spasmodic, like pain comes and goes. That's what we mean by colic. So we have sympathetic and parasympathetic nerves innervating the small bowel. Sympathetic come from T8 to T10, and they follow from the T8 to T10 portion of the spinal cord. The nerves go to the sympathetic trunks and the thoracic abdominopelvic splanchnic nerves. Which are these thoracic abdominopelvic splanchnic nerves? They include greater, lesser, and least splanchnic nerves. So remember, this autonomic nervous system, we have ganglia involved, and you'll have presynaptic fibers before you get to the ganglia, and sympathetic system to the GI, they will use celiac and superior mesenteric ganglia. Prevertebral ganglia, they're parallel to the vertebra, but at the region where you have the celiac trunk and superior mesenteric artery. So presynaptic fibers synapse at the prevertebral ganglia close to the celiac and superior mesenteric artery. With postsynaptic, they synapse with postsynaptic neurons. And when you activate sympathetic system, what happens? You reduce the motility. Remember, during sympathetic stimulation, sympathetic is fight-flight mode. So you don't want blood in the GI. There is GI shunt. You reduce blood from the GI to go to skeletal muscle so that you can flee. So there's reduced blood from the GI, and that way the motility of the GI and secretions of the GI reduce. In parasympathetic stimulation, mostly it's the vagus nerve, which is the 10th cranial nerve, and the small bowel mainly get from the posterior vagal trunk. So again, you have presynaptic fibers, which go and synapse with postsynaptic neurons at myenteric and submucosal plexus in the intestinal wall. Submucosal plexus are in the submucosa, and myenteric plexus are in the muscularis externa of the intestinal wall. So what is the stimulation of parasympathetic? At rest, what happens? You can still digest, there is peristalsis, there is GI secretion, and good digestive activity. So that really describes the innervation of the small bowel. So in the next lecture series, we'll discuss the large intestines. Thank you.